Good morning, Illini. I'm Matt Schrock, your host here for Healthy Illini Podcast, and welcome back. We're glad you're here with us. Today we are continuing on in a series we've been doing over the past weeks and months on health careers and meeting some of our staff here at McKinley Health Center. And so I am excited to get to the conversation with the two guests that we have today, and we'll get right into it. Today we're joined by two guests from our mental health unit here at McKinley Health Center at the University of Illinois. First up, we have Murata Ritter. She is the administrative nurse for the mental health unit. Murata, thanks for being here.
Thanks for having me.
And we also have Kaylee Haney, who is our care manager, or some might know the role as a case manager, but that is the role she fills here at McKinley. Kaylee, thanks for joining us again.
Thank you.
Yeah, you're both have been on the program before, so we're going to call you veterans.
Great.
But as we've continued on this series of health careers and introducing our staff, I thought it'd be cool to have you come back on because you have been on the program before. We know you in that role, but this gives you a chance to kind of expand what your roles are and who you are. So it's a really nice insight into some of our staff here. We have a large staff, one of the largest units on campus. So we have a lot of staff, so we try and highlight as best we can. But you both work in mental health. You both work closely together. Your offices are next door to each other. So you work closely together, but you have differing roles in what you do there. And so we're just going to start with that. Would you talk a little bit about what your role is, kind of what your focus is, and maybe just share a little bit what a typical day, as typical as we can get, a typical day might involve for you?
Yeah, so Murata here. I'm in the role of the administrative nurse. My role's more supervisory and supportive. So I actually oversee the day-to-day operations of the mental health unit. I support our support staff, so our office support associates who are answering the phones and scheduling appointments, our staff nurse who supports the providers and the clinicians on the unit, as well as the care manager, Kaylee, sitting right next to me. So I help with scheduling. I help with supporting the whole unit so they have the resources and the support they need to provide the best care to our students.
One other aspect that you do that's important is on a college campus and in a health center, we get a lot of students who are just learning how to take care of their own health care. They're learning how to navigate, learning what it means. And so we get students who come in who may not understand what they're asking for or not sure, or might be upset or not feel well. And when someone needs help, they call the admin nurse. I hear it on the page every now and then. So that's another aspect of what you do. And that's an important aspect as that go-between for the students and the unit.
Yeah, absolutely. We really try and take a education approach. We know that a lot of time our students are navigating healthcare services for the first time independently. So really educating them and teaching them on how do you schedule an appointment, what unit do you need to schedule an appointment in, what type of provider, how long should your appointment be, what should you ask in that appointment, and really just supporting them through navigating this complex process and then getting them where they need to be.
So that's a little bit of an insight into you. Kaylee, we're going to turn it to you a little bit because, again, you have a very different day-to-day and a different approach to what you focus on. So as a care or case manager, however it may be titled in a facility, what does that mean?
So my generic little spiel that I give is I help students connect to resources on campus and the community. What that looks like is we have a lot of students here on campus and specifically that come into McKinley that are not sure as to what are the resources on campus and what they can utilize and what's available to them in this, Champaign-Urbana area. And because some of our mental health services are short-term, we do see a lot of students who, really could utilize long-term care. And that's where I kind of come in and help bridge that gap and help them connect to those kinds of resources, whether that's finding a therapist in the community or, a psychiatrist or something like that can, help continue their mental health care.
And so for each of you, just a little bit, if you had to describe your typical day-to-day, like your one day from 8 to 5, whatever hours you happen to work, how would you characterize what your day, like what you do in that span?
So Murata again here. My day looks like first getting here, open my email, check my email, make sure there's no fires going on that need to be put out right away. And then I'm checking on my staff to make sure that they are here at work and running smoothly, don't need anything immediately. I then will typically probably roll into some kind of a meeting, whether it be a staffing meeting or a campus partner meeting. Um, Attending to any random overhead page or student that just shows up and just needs a little extra assistance. So being okay with going with the flow and diverting to a different course of action for a moment and then kind of coming back to that.
And part of that, to go with the flow is because you are not only managing students, but you're managing, if somebody calls in, if somebody's running late, and then that affects schedules, that affects appointments, it affects all kinds of things. And you're really kind of the air traffic control for a lot of that is kind of how I would describe it.
Yes, and I wear many hats. So if someone does call in, say my front desk person calls in, I might be logging on, answering phone calls until they get there, checking in students till they get there. If my nurse isn't here, I might be answering nursing phone calls or fielding medication refill requests and things like that. So yeah, just jumping in and filling in wherever's needed.
And there's a follow-up to that I'm going to get to about the uniqueness of our facility and compared to some other things, but we'll come back to that in just a moment. Kaylee, your day. How would you? You're giving me the look like I don't even know where to begin. How do you best describe what your day-to-day would look like?
So one of the aspects I love about this job is that my every day does not look the same. It looks the same technically on paper because I have a schedule, and I have students in these schedules. I have meetings scheduled from X time to X time. But however, the conversations in those times are just completely different from moment to moment. And that is something I absolutely love. And I like how my day is not the same and how I get to interact with so many different individuals in a day. So I technically start my day off with a meeting, usually right at 8 a.m., almost every day of the week. And whether that's with our mental health unit or, like Murata said, a campus partner. So both her and I serve on different committees throughout the university. Some of them we share together. Some of them we have separately. We both serve as like a mental health education and advocacy kind of a role. And we also represent McKinley as well in these roles and also educate just different campus partners on what McKinley does and how we can help in these kinds of situations that they're looking at. So outside of the meetings, I then roll right into meeting with students. I have openings usually in the afternoons and in the mornings that I meet with students. And then usually in the middle of the day, that's when I'm resource gathering, basically. So the students I met with in the morning, the things that they're wanting me to look into or find, I'm looking into that and sending some resources. And I also keep that open because I also communicate a lot with campus and community providers. And that's when I, try to reconnect with them or they're calling me back about openings or whatever else. So I have, scheduled blocks for those kinds of things on my schedule. And then I meet with students again in the afternoon. Again, all different types of conversations. I love it. And then I usually also have a meeting sometimes in the afternoon as well. Shocker. So a lot of face-to-face interactions for me in a day.
As we're talking about health careers, we try and highlight what a position would be like a case manager or an admin nurse, but it's important to also bring up that the roles you play are unique to the facility that you work in, not just here, but here at McKinley, obviously we have the mental health unit, but like Murata as an admin nurse, you also help put on the hat of admin nurse for other units if need be, or the front clerks might move from one unit to the other based on staffing needs and things like that. So you're not just doing mental health, you're doing, East 1, the immunization and travel. You're helping with all those women's health, helping with those kinds of things. And then for both of you, we're part of McKinley, which is part of the University of Illinois. And so, like you said, you're on committees and you're doing outreach things and things that you might not find at a different mental health facility because that's just not how they function. But then they have uniqueness to their parts as well. And you both have come from different, you worked other places before coming here, so you have different experiences as well. So how has that been seeing the different, I almost want to say manifestations of how your job functions in other places how does that, as far as healthcare, what are the options do you see that are out there that people can look at?
Yeah, so when it comes to nursing, that's actually my favorite thing about nursing is that once you become a registered nurse, you have a vast array of options in regards to what you can do. So just being a nurse opens so many doors for you, and being an administrative nurse at McKinley is just one of the many. I have been a staff nurse in inpatient mental health treatment. I've been a staff nurse at a prison in Danville, Illinois. So there's a wide variety of things that you can do, even in direct patient care and outside of that. And yes, it's going to look very different based off of where you're at. Where I am today is very different from where I started 12 years ago in long-term care at a nursing facility, nursing home. So yeah, it's definitely very different based off of where you are, but you find themes and you find specialties that you enjoy, like mine's mental health. So some people work in orthopedics, some work in long-term care. My passion is mental health awareness, advocacy, and treatment. So that's where I am.
Kaylee, what about you as far as a case manager, the variety of things that you can kind of step into?
So many aspects of that, just in general. So my background is social work. So I have my master's in social work. I know, we'll kind of get to that. But one of the reasons I chose social work is because A, I want to help people, right? And B, is because it's not limiting you to one thing. You can do so many things with a social work degree. So my previous place I worked before here, I had a lot of hats. I was a therapist. I was a case manager. I did crisis assessments. I also helped with our psychiatrists and coordinating all of their appointments and such, and being their direct liaison to mental health and our clinic at the time. And I traveled to different rural community clinics, and you see a whole different thing in those kinds of settings as well. So all of that was great experience, especially for me to realize what aspect of social work I really truly loved. And I really like aspects of every single one of those roles I just mentioned, but case management was one of my absolute favorites. So I was able to get enough experience to be like, okay, this is the route I want to go. And it was interesting because kind of in school, I don't remember as much learning about case management and what you do as a case manager role. It was just something like a part of your therapist role kind of a thing. And then when I found out this is like a job I could do full time, I was over the moon. I was ecstatic. So I was like, yes. And so went this route. I'm actually McKinley's first and only case manager. So I started 4 years ago. Wow. So I absolutely love it. I am highly supported by my supervisor, and her and I have really built this case management program. So going back to your original question, though, there's just so many aspects of case management. Just in general, if you have a social work degree, you can do so many roles.
Before we get to the education piece of this, because we want to talk about that, but that's for listeners who are like, I might want to have that as a career option. But there might be somebody listening, going, I want to talk to these people because I could use some help. How do you, as far as here at McKinley, because we're talking specifically now for this facility, if somebody is listening, they're like, this is somebody I could talk to, or this is somebody I have questions for about where I'm at. How would they get in contact with you? How would they make an appointment? How does that work here at McKinley's mental health unit?
Yeah, so you can give us a call. You can go online and see, you can log into your My McKinley patient portal. You can schedule an appointment on there with your primary care provider. You can walk in, schedule an appointment. You can walk up to the third floor to the mental health unit and say, hey, I need to talk to somebody. I need to talk to Murata, the admin nurse, or I need to talk to Kaylee, the case manager, and somebody will help you and get you scheduled. Ultimately, you're going to want to see your McKinley provider and get a referral to case management to really get connected with Kaylee for services. But yeah, just give us a call.
And we'll have that, as always, we have those links in the bio. You can always just contact McKinley, and we'll be happy to walk you through those options. But I want to make sure that we took a moment to let you know how to do that, at least how to take the first step, and then we can help with the rest of it. The next thing I want to talk about as far as these health careers is you've talked about what your roles are, and you've kind of already hinted at it. You mentioned it a little bit both. But if someone was looking at a career or wanted to know more about getting into the career of an admin nurse or a case manager or whatever, What kind of training, what kind of schooling did you have to go through to get the qualification for where you are now?
Yeah. So the administrative nurse role here at McKinley Health Center requires a bachelor's in nursing, and prefers so many years experience. I'm spacing on the exact number right now, but you want to have some supervisory experience and some years of nursing experience with a bachelor's in nursing and be a registered nurse licensed with the state of Illinois. But if you just want to be a nurse in general, there is the associate's degree route, which is, your 2-year program up to a master's to a doctorate now. So there's a variety of educational avenues that you can take to get a nursing degree.
What about case manager, Kaylee?
So my educational path, I started at Parkland. I got my associates, and then I transferred here to the University of Illinois School of Social Work to get my bachelor's. Then I stayed here for my master's, again, University of Illinois School of Social Work. And then at that time, so there's 2 different licensing that you can do for social work. I don't have any license right now. I just master's in social work, although I did all of the clinical experience to do so. But since I chose the case management route, you don't technically need a license for that in a lot of roles. Some places of employment might want you to and would require you to do so, but I don't. It's not a requirement for this current role. The requirement, though, here at McKinley is a master's in social work or a counseling background of such. So talk about a little bit of that LSW and LCSW route. So the licensed social worker, because I have friends who also are case managers who have both of those licenses. So the LSW, you have to have a master's degree, and then you can apply for the license. They took away the exam for that in January of 2022. And then if you also can obtain it with a bachelor's degree, but you have to have 3,000 hours of experience, then apply for the license. Then after that is the LCSW, Licensed Clinical Social Worker license, that you can obtain if you have a master's or a doctorate level degree from an accredited school. So after you graduate with said degree, if you have a master's, you have to do 3,000 hours of clinical experience. If you have a doctorate, it's 2,000 hours, and then you can test for the licensure.
So again, with both of you, what I'm hearing is there's lots of options. Yeah. There's lots of combinations.
Yeah.
There's lots of things, but that's basically the starting point for each is, as a nurse, get your nursing degree. If you want to go into the case management thing, you really need to go through a social work degree is where you're really starting. So, but those things you can find more information on, but that gives you a pretty good point to start with it. All right, before we close this, with every episode we've done this with our health career series, is that we've given each of our staff an opportunity to share who they are outside of McKinley, because the students often just know us as who we are within these walls, but we all know that we have lives outside of it. And so to try and give an opportunity just to kind of share who you are and your personalities and things like that, just going to turn it over to you and let you tell us kind of what you like to do. You can share whatever you like as far as your hobbies, your activities, things like that, and just give everybody a chance to get to know you.
So I wear many hats inside of work and outside of work. One of those is I'm a mother and a wife. I have 3 children. So I love spending time with my family. We enjoy going on walks, walking to the playground, playing at the park, venturing off to a state park and going for a hike. But I'm also a student. So I am pursuing my doctorate in nursing so that I can become a psychiatric nurse practitioner and work more directly with students and with clients with mental health needs. So very busy, lots of things, learning, teaching, parenting, all of the above.
Everything but sleep.
Exactly.
Kaylee, what about you?
So I leave this building and I'm, myself, and like you said, I have, a whole different world outside of work. And so I have a lot of things going on. one of which is I'm really active in my faith. So I like doing Bible studies and volunteering at church and listening to worship music. And as I said, listening, not singing. I do like to sing, but please don't give me a microphone. And then I'm also a wife and mom as well. So my husband and I have a almost 2-year-old little boy. So we love spending time together. We have a lot of family that's local here, so we love, getting to spend time with them as well. We like to hang out with our friends and do board games. Love board games. And go on hiking trips and camping trips, and we're big Jeep people as well. And then I also really like crafting. So just kind of different ins and outs things of that. Oh, and pickleball.
Pickleball.
Yeah.
We actually play pickleball together when we can.
Yes.
At this point, it's easier to find people who don't play pickleball.
Yeah.
It's kind of taken off.
Yes. I dragged her into it. She has play with me, please. Yeah.
But no, I appreciate, because half the fun for me of hosting these podcasts is getting to know the guests that we have on, no matter what the episode is. And we work together. I've been here at McKinley now 8 years, and so we've worked together for a number of years. I didn't realize it was 4 years for you, Kaylee. It seems like some days it feels like just a blink. But we don't always get a chance to get to know each other outside of our roles here, because we're all very busy. So that's half the fun for me, is to get to know people and who they are. And you can see through the way that you talk about your outside activities why you have a passion for what you do here too, because you enjoy people, you enjoy being active, you enjoy those things. And so it definitely translates to who you are each in your roles. So thank you for that. I appreciate it. But I do want to say thank you for being on the program today. I appreciate you taking the time and just sharing what you do as best you can in a very short period, because you do so much. But I just really want to say thank you for coming and sharing about what your career is, and helping our listeners to understand a little better what you do here, and give them some pointers if they want to look into it. So thank you so much for being here today.
Thanks
for having us.
There are so many careers in healthcare and in the mental health unit. We didn't even touch on the provider side of things. We didn't really touch on all the aspects of nursing that you can get into with mental health. There's just too many. But if you have questions about any of those, it could be something we talked about today, or an offshoot of that you have a question you're curious about, you want to know more, please contact us. We'll be happy to talk to you. We'll find somebody who has experience with those things or has some knowledge in those particular areas, and can share with you. So please let us know here at McKinley, Healthy Illini. We'd love to connect with you and have that conversation. If you have any comments on this episode or questions, let us know. We just want your feedback. We want to talk with you. This is about conversations, starting conversations. And so we'd love to continue that, and let us know. But thank you for joining us today. You're on a personal journey no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.